Hello and welcome to today's webinar with eLotus. We have been hosting educational courses at eLotus for over 2 decades and are proud to be your trusted source for premium CU content with over 250 speakers, 900 courses, and 3,500 hours of continuing education. My name is Donna Chow and I'll be hosting and moderating today's class. We're so happy you guys can join us today. Today's webinar is Hyperthyroidism and Hypothyroidism, Dr. Jimmy Chang's Herbal Master Sheet presented by Dr. Jimmy Chang himself. He is one of our best speakers out of 250 instructors over the last 20 years. Class will be held from 2 to 4 p.m. Pacific time. Before we begin, let's go over some important details about the chat room, questions for Dr. Chang, and your CU quiz. For the chat room, please set your chat preference to everyone so whenever you type and submit your comment, everyone can see what you're typing and be part of the conversation. For questions for Dr. Chang, please submit them to the Q&A box. And for your quiz will be emailed to you tomorrow and you'll get an email notification when it's ready. Our speaker today is Dr. Jimmy Chang, a doctor of Oriental medicine trained in Taiwan and a licensed acupuncturist here in California. He has over 40 years of concentrated clinical experience treating over 500,000 patients and applying his expertise in pulse diagnosis and herbal prescription. In today's class, you will learn the tried and true formulas from Dr. Jimmy Chang, the master of herbology, as he explores the art and science of his unique herbal combinations. You'll also learn the pulse indications for these specific conditions and how to prescribe a unique herbal formula for your patient. Dr. Chang previously taught a number of courses for us, which are now available as distant learning CU videos. If you want to be able to diagnose a patient's pulse, identify Western medical diagnoses, and create clinically effective herbal formulas, Dr. Chang is the person to learn from. He'll help you improve your pulse diagnosis and herbal skills. To learn his pulse system, we recommend the Gold Pass membership. Your yearly membership gives you unlimited access to his foundational pulse courses and herbs prior to 2020. And with the Gold Pass, you can also try the herbs he mentions because our sponsor, Evergreen Herbs, will provide you with an herb voucher worth the price of the Gold Pass membership. There really is no better value if you're serious about learning herbs and becoming proficient in them. To learn more, I'll post more information in the chat room. For now, let's get started with today's class with a quick overview of how Dr. Chang uses herbs because we do have some new students in each class and we don't want anyone to get lost. If you're a longtime student of Dr. Chang, please bear with me as I quickly review the information, or feel free to step away for 5 minutes. Dr. Chang's herbal style differs from the traditional methods taught in school. He only uses extract powders exclusively with evergreen herbs. Evergreen Herbs carries approximately 300 single herbs and 100 formulas. Dr. Chang's pharmacy carries about 150 single herbs and formulas combined. If you're curious about his pharmacy, a link to a YouTube video is included in your lecture notes. Formula evolution. Dr. Chang creates his own formulation that he frequently uses in his practice. He usually names the formula after what it's used for. These are his more recent formulations, which may change as he sees more patients and modifies them accordingly. Whenever he updates the formula, he'll add a 2.0 after it, so you know that there's a version 1 and a version 2. Next, what is Fang Jia Fang? Fang Jia Fang is the combination of various formulas to produce a better effect. Did you know that herbal formula granules are made in 2 ways? That first method involves combining all the ingredients and simultaneously decocting and extracting them, then turning that concoction into granules. The second way is to combine separate ingredients that are already granules and adding them together to make the formula. Evergreen does it the first way. In Fang Jia Fang, the concept is to combine formulas rather than single herbs. If you're unclear about the Fang Jia Fang concept, Dr. John Chen has created a YouTube video that explains it in a different way. Dr. Chang prescribes herbs in a 100-gram bottle or 150 grams if the patient is not local or if it's a chronic condition. The bigger bottle allows the patient to receive a discount on the herbs. For a 100-gram bottle, Dr. Chang prescribes 3 spoons 2 to 3 times a day. How to read Dr. Chang's prescription. If Dr. Chang lists a few herbs and then a number at the end, that means all the herbs before that number is at that percentage. For example, Dr. Chang's Sleep Combo 2.0 is 酸枣仁汤 at 40, 一焦糖 Hehuanpi, and Zutongyan at 20. Can someone tell me how many grams is Zutongyan? Go ahead and type it into the chat room. So sleep combo is sleep combo 2.0 is 100 grams total with 40 grams Suanzao and 20 grams each of Yijiaoteng, Hehuanpi, and Zutongyan. So the answer was 20 grams. Great work, everyone. Next, do you have to mix herbs by yourself? You certainly can. Some herbal formulas such as circulation sanjiao, astringent, and herbal ABX have already been pre-mixed as collection formulas, which is Evergreen's proprietary line. Many of the new formulas are not pre-mixed because Dr. Chang is still working on them and customizing them, so please feel free to mix them on your own or use Dr. Chang's formulas as a base to create your own formula. And that's it for the short intro, everyone. I hope it was very informative for you. Let's now welcome Dr. Chang, who will go ahead and take over from here.
Today, I'm going to talk about some kind of thyroidism, hyperthyroidism. So can you see the, okay, I'm sure you can see the picture now, huh?
Yep.
Today
nice.
will be hyperthyroidism and hypothyroidism. It's very effective and is very, very interesting. And then whatever we previously have talked about over the internet, everything is based on my 45 years clinical experience. Huh? Today, I'll be talking about hypo Hashimoto thyroiditis and simple goiter, how to treat them and how to make the proper diagnosis. The interesting part of this thyroid stuff is amazing. Let me tell you what. Okay. Everybody can hear me correctly, right? The microphone is working? No problem, huh? Okay. The problem of this thyroidism, the diagnosis with this kind of a problem is that all those symptoms are non-specific. All the post-diagnosis are maybe non-specific too. So it's very confusing. But once you get familiar with all those strange symptoms and you narrow down to the thyroid, you blame it, all the problem to the thyroid, then you'll be able to treat the patient's problem more effectively, more than the simple the differential diagnosis according just to the symptoms. The old ancient book, your textbook, say the 辩证论治, 辩 means make a differential diagnosis according to the symptoms, which is totally useless and bad. At least you guys here listening to my all the seminars, you all know my post-diagnosis system very well. But today, I'm going to tell you something that's a little bit more out of the box. You're going to like it. Okay. For example, the hyper stuff. You have a lot of symptoms: weight loss, rapid heartbeat. Now, people might get rapid heartbeat. It might be mistaken as a heart problem. Oh, the heart problem, go see a heart specialist, and the specialist give a EKG and everything and put you on a pacemaker or something like that, huh? Increased sensitivity to heat. The fire we experience. We might use some US one, something clear the heat with something like. Actually, it's not just simple heat. And sweating. Oh, some lady will come to you, say, hey, doctor, I have hot flushes. I sweat all day long. I mean, especially at night. Hey, doctor, I have a tremor with my hands. Somebody might tell you, I have irritability and nervousness. I'm just nervous all the time. And the heartbeat is fast. And somebody may tell you, oh, doctor, I'm so weak. My muscles are so weak. I cannot lift a heavy weight, and whenever I do something, I feel tired all the time. And somebody might tell you frequent bowel movement. I go to bathroom all the time. Hey, doctor, help me. Naturally, you will think through the point to the digestion system. You may focus your pulse on the one area, on the left hand guan or on the right hand guan, according to my second system. Somebody, lady might come up to you, says, I change in menstrual patterns. My period comes sometimes heavy, sometimes it's very limited, very small, like 3 days is gone. Sometimes it comes in 7 to 10 days. Then naturally you will focus on her left-hand side, left chi, because that's the genital area. And somebody may tell you, oh, this is very popular. Or you can make your own diagnosis without having the patient to tell you what's going on. But after you made up your mind, hey, you have a problem. You're so nervous. You have anxiety. You have stress. You have depression. You cannot sleep well. Okay. Naturally, you will go to my Feng Jia Feng, my sleeping anxiety combo stuff for this her problem. Maybe suffering somebody from high blood pressure. Of course, we might want to use my blood pressure medicine, blood pressure combos, things like that. Oh, somebody say, I always eat too much. Please, doctor, please help me to suppress my appetite. I'm gaining weight. I'm not losing weight sometimes like that. You see, all those problems, if you go to the, like my experience in Taiwan, if you go to the hospital with all those complaints and discomfort, you might be lead to a different department. Frequent bowel movement, you could have digestion to the stomach problem, muscle weakness, you might be transferred to the nerves doctor, and this you might be transferred to a psychiatrist. Then this you got to a doctor with internal medicine. Then you will be transferred to a doctor with the psychiatrist or something. So all those things actually you can narrow down to the thyroid. Thyroid has two. The pulse can be okay for this kind of problem. The pulse should be in deficiency, thin, floating, fast, and weak. The pulse can be this, but it's very superficial. When you press down, there is no rebound underneath, and the majorly is the fast. So we kind of like in deficiency because your body is exhausted because your thyroid is moving too fast, like the engine is moving too fast without going anywhere. So after today's, you might have the idea that all those problems can be originated from here. This is where the thyroid is. And also you might see some red spots here. This is the, let me try this one. This area may be the ovary or testicle of a man, but if you see some redness there or darkness there, that can be the thyroid. Almost seems like this. So from today on, you have widened your perspectives and you can learn more from being told all those discomfort. And you'll be able to make your proper diagnosis and make the proper decision how to treat this patient. And what I'm trying to tell you is that you might ignore all those different kind of complaints and just simply narrow down to the thyroid, and the treatment will be much more successful and wide spectrum. Isn't that great? Okay. So, so like, I mean, traditional Chinese medicine, they treat symptoms, syndrome, or whatever. Symptoms are totally unreliable. You must focus on the reason, the root of the problems. Now, today you learn most of the different kind of different area, all the discomfort coming from a thyroid. Isn't that great? We made the treatment easier. You don't have to treat the blood pressure and treat his sleeping problem, treat his bowel movement, treat his weakness by adding something like a 十全大补 for that. You don't have to do the my anxiety combo for this tremor, and you don't have to do the sweating or the female part with the hormonal treatment. You don't have to do the hard herbs for the rapid heartbeat, tachycardia. No, you don't. You focus on the thyroid. That's the point of today's class. Okay, this is the stomach, actually it's intestine. And this is abdomen. Abdomen, the swelling tissues is just in this picture, but not related, might not be related to the thyroid. And this is the hip. See the darkness there? He might have some old injury from the pain. Okay. Any questions so far? We narrow down all those different symptoms just to one thing. I mean, the thyroid. Okay. Okay, but for pulse diagnosis, unless it's very extreme, that's this lady. I've met several ladies that are so nervous. They even when they talk, they cannot stop talking, and a lot of shaking in the voice because she always forgot to breathe, so cannot catch her the breath, and just keep on talking all the time. But that's and sweating and being thin and that symptoms too much. It's too easy to identify. But most of people, even sometimes their blood test shows normal. Their thyroid has nothing abnormal, but we can still narrow it down and blame it to the thyroid. But how do we differentiate the condition? I use my pulse diagnosis, something like this. This is the normal pulse. 寸关尺 is here, okay? But this is the tendon and this is the 少阴. Usually, I mean, before, I use the 少阴. 少阴 is a little bit shorter than the normal 寸关尺, but still have 寸关尺. This 少阴 pulse might not be there all the time. You can check your own 少阴 or your patient's 少阴. Sometimes they're just not visible, not you don't feel any rebound, but sometimes it's very hard. For the right-hand side, well, it doesn't matter. Sometimes it doesn't matter left or right. Only for the sex hormone. The sex hormone on the right-hand side is the male hormone. Left-hand side is the female hormone, the sex hormone. So if the lady presents a very strong showing on the right-hand side, I always tell her that you're so bossy, and they all laugh and nobody ever deny it. On the left-hand side is the female hormone. So if you're treating a guy, a guy too, yeah, a lady with infertility, you should focus on the 少阴, both hands, if they do have enough hormone or not. If both hand, the 少阴 is very weak and no rebound, you can, if the lady only 35 years or 40 years, you can directly tell her, hey, you're aging too fast. Your body is older than your age. Or anyway, on the right hand side of the human, on the pulse, is, it doesn't matter if for thyroid, it doesn't matter left or right. It only matters is the strength, the strong or weak. Strong means hyper, weak is hypo. So simple. Isn't that interesting? So easy. All you have to do is follow the sign and do the treatment plan accordingly. Try You know how to take the pulse, right? This is almost heart 7, 神门穴, somewhere there. Okay. A patient would not necessarily have all those symptoms. Of course not. I'm seeing a very slow heart rate with blood work showing subclinical hyper. Yes. With high normal hormones and below. Yes. That's a good question. And I just seen at least 3 ladies with this conflict. I just directly tell the patient, hey, your body is a conflict. It's a paradox. Why? Because her symptoms, her ear point shows all red and stuff, and the thyroid part is dead fish, not jumping, no rebound. So I tell her, your body is not functioning too well. Your engine is running, but your temperature is high. Your activities are too strong and unstoppable. So that's a very conflict condition. Hot and cold, fast and slow, strong and weak appears at the same time. So that's why I gave her 乌梅丸, 小柴胡汤 to balance it up. That's correct. Yeah. So sometimes the pulse and the ear signs don't match, but I'm going to tell you later. Oh, okay. Just make sure you take the shao in pulse all the time. After taking the normal pulse, then you go to the shao in, see, and record it. Put on your evaluation sheet. Okay. Interesting, isn't it? Not all the human body can be that unique, can be that simple. All heat from top to bottom, all heat, all cold. No such thing. Capture. Which side? For thyroid, doesn't matter which side. Okay, next one. Okay, for pulse diagnosis, Shaoyin, how do we treat the hyperthyroidism? We do this. Herbal formula hyper breaker. It's interesting. It's very easy because see, this area is not very clear, but there is clear. That's hyper, especially the heartbeat rate. And see this guy, this head is red, has some scar in the stomach, and all the redness in the stomach. And see all the redness, the knee joints, and the colon is very dirty. And see the neck and shoulder are dark, and this is the head. It's dark too. So this patient, so this patient is full of conflicts and paradox. So when you treat him or her, you should be very careful. See, the head is red and the neck is dark. So we might use cold medicine to clean the heat, or use blood mover to do the stagnation. And see, this is supposed to be the gallbladder or something. And this is stomach, is one red and one dark. So this is her body or his body is already a paradox. But anyway, for the hyper stuff, when you make up your mind, after you made up your mind, hey, this guy is hyper, then I use 玄参 and 夏枯草. I use this. It's a combo, like a code breaker or something. Heartbreaker. 三联儿珠 is kind of a code breaker to break up all the blockages. 虎杖 is for drop things down. 虎杖 is a very wide range herb, broad strong, a spectrum, broad spectrum, because it can clear the heat to drop it down. It can clear the heat in the respiratory system, like for cough, for the throat problem, which might be also the result of the thyroid. I'll let you know later. And Hu Zhang is good for moving the blood. It's very funny. He's cold, but it still moves the blood. Astringent complex is for any swelling tissues. I'm sure everybody knows this. If you don't, check with Tina. Hello. Okay. So this combination takes care of all the aspects. I use this Xuansen. Xuansen is supposed to be a dark and a sour and bitter medicine, cold and sour, so it will shrink all the swelling tissues. And 夏枯草 is the same. 夏枯草 is good for thyroid, and this guy must have some kind of headaches. Sending Erzu just works like a bulldozer to clear all the blockage on the road. Hu Zhang, I explained earlier, is for lowering the heat and for dropping all the phlegm and in the chest, not only chest, but in the throat. So the throat problem can be the result of, from the thyroid. Astringent complex is good for any kind of a swelling tissues or forceful swelling process. Try to bear it in your mind. So you can put them together. That's what I do. Put them together. Okay. Any questions? No more.